Hi, Joel. We're just kind of waiting as people start joining in.
It's 12 o'clock.
Can you hear me?
Yes. Hi, Joel.
All right. I'm going to mute myself though.
Okay, that's fine. That's fine. Unmute if you have a question as we go along. I'll give a few moments here for others to join in and then just kind of walk through a number of updates. I will share that I continue to be surprised by every phone and computer having a different time. So I feel like there's about a 6-minute difference between my computer, my cell phone, my wall digital clock. It's so weird. It just seems like they should all be the same. So we want to give a few minutes here for anyone else that will come in. Hi, Carrie. I'm seeing others joining in. We're just going to give a few minutes here for others to get on. For those of you that are on the line and we're just waiting a few moments to be sure we get the majority of folks that may be joining on the call. I will share we are recording this call, so Ashley will be helping us post the audio version of the call so that others can listen in at their leisure in addition to the couple of sessions that we've created to provide this update. What do you think, Susan? Should we just go?
I would say probably, yeah. Let's just do a run with these kind people that have joined us who we know are going to be our cheerleaders.
Sounds good. Well, as everyone is aware, the COVID-19 pandemic is resulting in a number of procedural and process restrictions across our communities that are truly impacting kind of everybody at every level, from employers to service providers to government agencies and whatnot, as more directives from the federal level are trickling down to state and local levels. A lot of additional restrictions and protective measures are being handled, which I think most of us appreciate in regard to contain the situation with spreading of a virus. But at the same time, we still have a duty to our communities as a community foundation to look to what is our role, what is our purpose. So this call is kind of an educational briefing to bring all of you up to date on kind of what the foundation as a whole has been doing and some of our connections with affiliates. This call has just been invited for affiliate board members, so this is more of a private training educational update session. So just so you all know, this kind of series of updates is for really our internal protocol, so just be aware of that. So I will begin by sharing after a couple of active leadership calls and sessions with Harvey County related emergency management and other health department leaders and whatnot. We were able to convene a number of our staff, and Becky is our community liaison with our affiliates to determine what was our best approach for being responsive to this situation. The Central Kansas Community Foundation Board, between last night and this morning, approved the activation of a Central Kansas Community Relief Fund. There was agreement to activate one fund versus a series of funds across our region. Even though many of our affiliates have worked to establish the readiness for a community response fund or a community relief fund of some nature. Because of the widespread impact, we felt it would be simplified to have one resource, yet this doesn't restrict how a donor could restrict their gift to one of our communities. So I want that certainly for all of you to be aware of. So with the fund activation, more will be coming out on social media that the fund is available. We are already aware of some potential government support fund, and we have already had an established donor with us step forward with a gift, and I believe more of those will begin happening as the public notification of this fund is known. So we've been asked what is the most important thing for our affiliates and our local team to be doing. If you have not already, become engaged with your emergency management team in your city or county. We are strongly encouraging that you at least make a connected line to those groups, notify them that this fund has been activated. Their public information officers or emergency response teams will most likely like to incorporate, that our fund is activated because we're a reputable, trusted entity for this time in this type of a situation. So in the correspondence that was sent out earlier, there was a button for you to direct click into the, now I'm going to forget the exact name of it, the workbook, the crisis communication workbook. The button was in the constant contact email correspondence as well. You can find it on our website on the COVID-19 page. That workbook has your contact information for your local emergency management contact if you are not aware. So please know those resources are in that document to assist you in reaching out and building a bridge during this time. I believe the public information officers are in there as well. Is that correct, Susan?
Yes, it is, unless Ashley would say otherwise. I believe that is part of it.
Okay. Plus, there's just other talking points and general things. Of course, our tendency is to be establishing that communication guide for natural disasters, tornadoes, floods, and whatnot. But certainly, many of the talking points would still apply with modification to this circumstance. So,
Angie, if I might jump in just really quickly, I am currently in the process of making this workbook relevant for the COVID-19 pandemic.
All right, very good.
So that should be available later today, even though the link is out there and still has the list of emergency response management managers. We do not have the PIOs. I never got that information from Andrew per that email that I sent, but certainly I think we can get that information out through the response management in each one of those communities. So to that, then that resource will be available specific for COVID-19 following this call.
Okay, so stay tuned. The link is on the website page for this initiative, and updates will be there as they're made. So thank you, Ashley. The role of community foundation during a time of disaster, I think it is important that we stay in a frame of recognizing that we are a philanthropist organization. We are a funding organization. I think recognizing that we have our strengths in being able to manage donor gifts and distribute them in a organized and recognized way on behalf of what our communities need. We are also very equipped as conveners and connectors, just because of the nature of our work and our role with our charitable and other tax-exempt entities in our communities. Those relationships are extremely heightened for knowing who can do what, who can supply what, where are the needs, where are the resources. So all of you as professionals and leaders in your community, keep your foundation hat on in regards to the knowledge that you have about general aspects of who does what and who can respond. Additionally, Becky, myself, Susan, all of us are available to have dialogue about that if you are not aware or a need is identified and you're not sure how to proceed or take that forward. I just think it is important that we also recognize what we are not. As a community foundation, you know, we are not the first responders to this. We're not the medical professionals. We're not the ones on the ground doing the responsive triage to this situation. We're not therapists. We're not case managers. I think those things are important because it's easy to get a line between, you know, wanting to convene and help and support, and then what the role of the foundations are in our region. So just be aware of that. I think we can also find ourselves, because we are trusted and we are relied upon for knowing the charitable circuit, that we will be asked and inquired about how we are supporting our communities. And so I think just staying hard fast to what our purpose is and how we can help with garnering resources to help disperse to the greatest needs in our community. And I think it's important to also note the shift in this may go beyond just our typical vulnerable populations, which of course are high priority, our elderly, our children, our persons with disabilities, but recognizing this is affecting the masses, and there may be needs that we have not traditionally supported with our grants and awards that may be stretched to recognize direct service providers will be stretching their missions to ensure the public at large is taken care of. So a component to just be thoughtful about at this time. Just kind of looking at my notes, there's a lot to kind of think about in this component. But I do believe just knowing those roles of what we are and what we are not. For what we are skilled at, we have already distributed a charity survey just to get a pulse on what is currently happening, what their needs are. Those needs are spanning from everything from the food and medical supplies to child care support, to general staffing support, as many older parties of our community are volunteers, and many of them are self-quarantining to be more safe. And many of our charities, from the review of surveys coming in so far, are just concerned about how they can function with the lesser amount of volunteers in general. So as we get more information collected from the surveys, we will be sharing that Becky is going to be outreaching to the affiliates to encourage them to assist their charitable base in responding to the survey, so we can be more aware region-wide on how we need to identify for funders and partners what the true needs are. Susan on Monday will be doing her first push out individually to you all as communities for resources that we're hearing about and the needs from the charities that are responding to the survey. So that will be our first approach. We'll continue collecting these next days. It seems every little bit more of the survey responses are coming in. And Monday, Susan will at least give her first report out to all of you as to what she is hearing and learning about. In regard to the activation of the fund and local funds, we recognize that it is always healthy to have a public-private partnership in these types of circumstances. So we believe that as the resources into our fund grows, we also have opportunities throughout our region with our foundations that may have funds that have available distribution dollars that fit the needs of some of these requests. In particular, some of the unrestricted community impact funds could certainly be considered for utilization for requests. We'll be learning more about as days go on, as well as unused Kansas Health Foundation public health funds that all of our foundations that received GROW dollars and matching dollars. I'm sharing, we've already had conversations with Kansas Health Foundation. They're definitely supportive of us broadening our scope, being very flexible with those dollars, and recognizing that's a perfect way to expend the available for distribution portion this year for those affiliates that have not already had their grant cycle. The grants, again, maybe there will be an opportunity to match maybe the activation fund in addition to a local fund like the Kansas Health Foundation Public Health Fund can be leveraged to support the needs. So recognize there are opportunities there. Susan is leading the next steps of now forming a relief fund review team that will review applications and help in guiding matchmaking of resources and funds. We recognize, because again, this is a regional need, and the activation of one fund that may disperse to a variety of communities, that Susan will be working on assembling a team that is broad and covers our region with different talents. I would ask if you or someone you believe to be more of an expert or knowledgeable about community response, emergency management, that isn't going to be directly compromised with their attention on the streets. They might be great people for Susan to look at. She and Michelle and Christy are also looking at their volunteer list to be assembling this committee. It will still be a smaller, more manageable committee, I would assume, in the 9-person or less, just because we know from our review teams and the circumstances we had with the Heston shootings, we have to act fast when we do start recognizing there's very immediate and issues of necessity that we want to fund, and we need those reviewers to work together very quickly. So I don't know all the complete details of that, but more will be coming, and we look to you out in our communities to recommend to Susan particular individuals that would be significantly positioned to help in us helping make decisions. It is also important to keep in mind from the government professionals that we have visited with and other community leaders, from Susan's training and experience as our disaster coordinator, we strongly recognize there is an immediate short-term need in these circumstances. There's kind of a midterm, hey, what's happening? What have we done? Who have we supported? Who hasn't been supported? What are our next steps? And then the long-term recovery and community resiliency that we have been talking about for these last few years, that when trauma and circumstances happen, there are a lot of additional fallout circumstances that occur at the individual basis, at the systems level, and at the community level. And clearly this is something not only affecting our communities, but the state, the nation, and the world. And this is very uncharted territory that I think we all have to be aware of and be conscious of. And as I know I've said several times, we just got to stay calm, stay focused for our personal needs as well as our professional responsibilities. So with the charitable funds, more will come. I certainly know with our ability to cut checks through our office internally now, we have the capability of responding, very quickly. I don't know yet if I can, honestly say if checks will be starting to be cut next week, but I would think within next week or the following week, as the review team is assembled and needs are more fully coming forward, we will be able to respond with financial support through grants. And Michelle Critchfield, as our grant officer, will also be helping in support of the entire region as we go forward in this path. As you all know from your other work involvements and your volunteer roles and the foundation, there is just normal business as usual. Business as usual is different. We are functioning away from the office to adhere to Kansas Health and Environment, Kansas Department of Health and Environment protocols to reduce the spread of the virus. We are also recognizing the importance of all the CDC hand washing regimens and whatnot, and encouraging everyone to comply with those recommendations. Yet, we are a business, we have bills to pay, we have responsibilities to vendors that through the acquisition of processes through each of our affiliates need to be tended to. We ask that for support of Melinda in accounting, processing your expenditures and the grant requests through Michelle and Susan, that requests be shared as fully as possible, and receipt of the request and all the backup materials, the backup receipts, backup requests. The more that you can package that on the front end to Melinda, the more expedient we will be able to be to respond to those needs and requests. I also recognize some do not have those capabilities. So instead of the convenience of dropping off at our office, just put in the mail all the backup information in the request. I would suggest you copy it first if you can, or take a photo with your phone so that you have backup to that correspondence. And then again, we will receive those payables and requests as quickly as we can. In addition to business as usual, we know that several events planned for the foundation have been postponed or canceled. Through the midpoint of May is what I'm aware of at this point. Everybody is taking a conservative stance on not convening in crowds and groups. As updates to that progress, we will certainly post that on our events tab on the website as new dates come forward or extension of postponements. for individual affiliate board gatherings. I know several boards are postponing their meetings, and we are certainly wishing to help you in any way with accommodating your board through Becky to coordinate Zoom calls. We have been experimenting and working more with Zoom, a similar product to Skype that some of you are familiar with, for conducting meetings just like this one. And we are happy to establish those links so that you can function with your local board members, communicate and discuss your needs amongst yourselves, but we can help with the technology to support you in that. You can make those requests to me and or Becky for helping get that set up. But actually Michelle Kirchfield and I are the two that have the more detailed knowledge in setting up those calls and all, but our team will help you. If you have the request, we'll make sure that you know how to access the call and get supported. I think my other notes of mention are we're conducting at 6 p.m. tonight this similar type of a communication call, and at 8 a.m. tomorrow morning. And then beginning Monday, we will continue to have a daily noon update. So as people want to just convene and get a briefing and update on kind of where we're at and next steps, we've decided through next week at noon each day we'll conduct a call similar to this for updates and to also receive feedback from all of you as more unfolds in your communities. Susan, I may open it back up to you. I think I've exhausted my notes, but let me know what I forgot.
No, I think that was very thorough. Thanks, Angie. One thing that I think would be important is to make certain that you are in communication with your county's health department. They have made it clear to us that because this is a health-related incident, that they really are taking the lead. And so that would be something that I would add to the conversation. I also think that it's really important that we continue to just be hopeful and energetic and a positive force in our individual communities, which is asking, you know, something that wasn't really on the agenda list. But I think a lot of people are not aware that this is a traumatic event. It's an opportunity, but there are going to be a plethora of emotions that come with this, and our training background would tell us that we need to validate that and assure people that it's quite normal, and that they should maybe, you know, talk that through with people and practice self-care. The other thing, Angie, I wondered if we should mention is the reason why we have decided to take a fee on this particular fund. Do you want to talk about that a little?
Sure. Just if, as you see the link to the fund, we have a little disclaimer note. I'm wondering if I can find it fast so that I can read it to you. Hang on one second. We have put on the fund link for donations a disclaimer that states the work required to lead this initiative is, let me see, the work required to lead in this initiative is valuable, and we are, oh my goodness, I can't even read. We are like any other service provider and must cover our costs or risk destabilization of the foundation. If I didn't have things coming up on my site, I could read this better. If that were to happen, we cannot respond, convene, or assist. Be certain we will limit our fees to covering costs only and are committed to adding our own unrestricted resources to the fund to show our commitment. And we thank you all for joining into this important. basically what we're just trying to say is we're not saying we're not going to take a fee, but we're not saying we won't include a fee. After numerous disasters across the nation, mass shootings, our shooting experience, other flood and water disasters like in Flint, Michigan, we as a network of community foundations across the nation have been encouraged to recognize that our own operational fluidity could be intervened if we don't have resources to keep ourselves operational. And that could mean, in the event of a huge amount of donations filtering in and a huge demand of needs, that we could need additional resources even to operate ourselves. And Susan and I both have been part of conversations in our prep cohort, as well as presenters that have come to convenings that Susan has participated in, that definitely recognize where we want to be positive and good-willed about our passing dollars through the foundation. We too could experience the need for bolstering our operational resources, which could as well cost money. So we're just trying to be as forward and transparent as we can with that messaging. Please read it yourselves. I don't know why I was getting so tongue-tied trying to read that, but I was having other emails popping up. If you go to our website, Ashley has done a great job of posting in a number of places, donate now, and then it's a direct link on our brand new donation platform, and you'll see a description included there.
I don't think I have anything else. And certainly if you who have participated in this call have suggestions that you feel would help us bring clarity to our call later this evening and tomorrow morning, we would appreciate hearing from you before 6 p.m. so that we can thread that into our messaging.
Yeah. And so with that, I would offer, if there's any further comments, if anybody wants to unmute themselves and make any comment, we welcome that. Seeing no response, I think we'll go ahead and end the call, and definitely share any updates that you have by email to Susan or myself. And as she mentioned, we will incorporate that into future conversations. Thanks for your time.
Thank you, everyone.
Thanks.
Thank you.